Hi, I'm Beth LeBlanc. I'm a reporter with the Detroit News. We're here today with Dr. Daiza from Henry Ford Health System. We're going to be asking her a lot of the questions that you guys have submitted to us over the last couple of weeks. There have been a lot of questions. We have not been able to get to all of them, and so hopefully we will be able to address some of those today. Dr. Daiza, before we start, can you please tell me a little bit about yourself and what you do at Henry Ford?
Good morning, Beth. Thanks for having me. I am a family doctor. I work in primary care over at the Bloomfield Township location with Henry Ford Health System.
Cool. Well, thank you so much for being here with us today. And just a reminder to folks following along, if you'd like to submit questions on the Facebook page, you're more than welcome to. We have quite a few that were submitted to us yesterday, so I will get to it. So one of the first questions we had, Dr. Daiza, was, is there an advantage to wearing gloves? If you touch anything, I suspect you would need to throw them away before touching another object, like pumping gas or touching the steering wheel. What's your advice on that?
My advice at this time is to leave the equipment to the medical personnel. We are very low on gloves, on masks, on gowns. So at this point, taking normal standard precautions, washing your hands regularly, using hand sanitizer, but using gloves if you're not a medical professional at this time or not in the food service industry or an area where you would actually need to cover your hands. If it's just for your protection, avoid touching your face, making sure that you are using those hand hygiene precautions.
Okay. Why is it that we're not hearing any information about how long it takes for a person to recover or for a person to be on a ventilator if they're in pretty bad shape? I know everyone's different, but it seems like there should be an average number of days for recovery or for being on a ventilator in that case.
That's a difficult question to answer, Beth. And the reason is because every patient is a little bit different. And it depends. It depends on their age. It depends on their other comorbidities. Is this person an asthmatic, or do they have a long smoking history? Those people may be on a ventilator for longer. So unfortunately, we don't have a solid answer, and I don't have an exact number of how long. It's a case-by-case situation. And we do check in the ICU every single day. We do trials to see if we can get the person off of the ventilator. And again, it varies from person to person.
Okay. This one is from a reader. She says, I have lung cancer and am supposed to have chemo treatment this week at Carmenos Cancer Center in Detroit. I spoke to the oncologist doctor and she assured me that safety precautions are in place. But I would like your opinion on this matter.
So if you're a chemotherapy patient and you have a scheduled appointment, although we want you to avoid going out to places, you don't want to miss your chemotherapy appointment, particularly if your oncologist is okay with it. And as the patient mentioned, that the oncologist is taking all the precautions in their office, please don't miss that appointment. Very important. Any other reason to go out, you should make sure that you're taking every precaution or have someone else go out for you if possible. But necessary medical appointments, please don't miss those.
Okay. Can chloroquine and antibiotics help treat coronavirus like President Trump said?
So this is the million-dollar question, very important question, and I want to touch on this for a little bit. So let me be very clear. This therapy is not approved yet. It is not. That therapy was suggested because of a very small study out of China, about 20 people, and it showed that there was a decrease in the viral load of coronavirus, which is a good thing. And that's the reason why it's gone on to longer trials. But that's what we need. We can't compromise what we normally do for therapy. And what do we normally do? Large scale randomized trials so that we know that it's safe before it's approved and given to the public. So, I want to make a point to other providers as well. Please, again, practice evidence-based medicine. We as practitioners should be there to educate our patients and let them know that this is a potential treatment, but it is not approved at this time for treatment. So very, very important for people to understand that this isn't, even if you've been diagnosed or if you have a suspected diagnosis, you shouldn't be getting that treatment at this time. And I worry, Beth, because azithromycin, for example, which is the antibiotic part of that combo, it's widely used for pneumonia. And I had a patient a couple of days ago who I needed to prescribe it for her pneumonia. It took 7 pharmacies for me to get her that medication because we're on such a back order because of, doctors over prescribing or patients requesting these medications unnecessarily. And so I worry about the actual use of these medications, what they're approved for at this time. I don't want a shortage for the patients who actually need it. It's not approved for coronavirus at this time.
Okay. If I'm a grandparent, should I not be around my grandchildren right now? Especially if I'm used to watching them while their parents are at work or what have you.
So grandparents should not be around their grandchildren if possible. So hopefully someone else is able to watch them. Again, we know that children, although their symptoms are more mild, but they are carriers, and our elderly are part of our most susceptible group, our concerning group, actually. And so having them avoid potential carriers is very, very important. So if someone else can watch the kids, that would be ideal. I know for myself, I spend Sundays with my 87-year-old grandmother, and I haven't seen her, and I miss her so much. And it's difficult to social distance. Well, I should say physical distance, but we socially connect. We talk every day, but to physically be around her at this time, I do not recommend that.
Okay. I've seen reports of a so-called L and S strains of the COVID-19 virus. Is this conceptually similar to the different flu strains we're used to? Does contracting and surviving one strain of COVID-19 provide cross immunity to the other?
So that's being studied right now. That is also from a very small study in China. And they found, as you mentioned, the L and the S strain, and one was more prevalent than the other. The main thing to come out of that is that it doesn't change our management. It doesn't change at all how we're treating patients or what we're doing for patients. So although that study did come out, and we are continuing to study the strains, and it's not uncommon for viruses to mutate or have multiple strains. That is actually common. But again, that's being studied, and more importantly, not changing the management, not changing what we're doing for patients at this time.
Okay. I was told I can't get tested, but I'm feeling worse. What should I do? And kind of piggybacking on that question as well, for someone who is relatively healthy, has COVID-19, or believes they do but can't get tested, what should they be doing at home? Should they be taking any medication or resting, or what's the recommendation there?
Yeah, so most symptoms are mild, and they can be treated at home with conservative management. So at this time, we're telling patients to avoid anti-inflammatories, like things like Motrin, but taking Tylenol regularly, getting plenty of rest, getting plenty of sleep, conservative measures at home. If you are a suspected COVID-19 patient, then quarantining for at least about 14 days is what we're telling patients. And then once your symptoms resolve, at least 24 hours, and then recheck virtually with your PCP. Now, you mentioned, or you asked initially, what happens if your symptoms are getting worse? And it depends. So for one, we are here. Our goal is to try to reduce the influx on the hospital side. So call your PCP, and I have a hotline right here. I can mention it now and mention it again later, but it's 313-874-1055, and it's for Monday through Friday, 8 to 5. And it's a hotline for patients, and either you can schedule a virtual visit with us, you can call, you can call your primary care doctor, but that's really important to make sure that you are in touch with your doctor, because if you're not sure, is this something I need to go to the ER for? You can talk with us and we will let you know. Now, if you're home and you've had an illness and the symptoms are getting worse to the point where you can't control them at home, and what do I mean by that? Fevers that are not controlled with Tylenol. Now you're developing chest pain, difficulty in breathing, the shortness of breath, that warrants a visit to the ER. But if you're not sure and you're stable at home, call us. We're here. Your primary care doctor is available, and we will be more than happy to guide you and with the right treatment plan or where to go.
Okay. Is there a way to self-diagnose coronavirus?
So at this time, we're assuming that everyone has it. That's how we're treating this, because there are so many asymptomatic carriers out there that maintaining the 6-foot distance, social distancing, isolating yourself if you're ill. But there is no way to know if you have the coronavirus without a swab. But if you're ill, and what are the symptoms of coronavirus? We didn't even touch on that yet. Fevers, the most common symptoms. Fevers, a fever constitutes a temperature of 100.4 degrees Fahrenheit or greater. Shortness of breath and cough, particularly a dry cough. And then there are other symptoms as well that we're finding, but those are the most common symptoms. So particularly if you are exhibiting those symptoms, we should be assuming, and especially because we are so limited on our testing, that you do in fact have it. And you just have to treat it as such. Conservative management at home. Again, I want to reiterate the combination of hydroxychloroquine and azithromycin is not approved at this time. So the treatment is conservative management. The treatment is supportive care. And again, if you have questions, you call us. If your symptoms are not well controlled at home and you've tried things at home, that may warrant a visit to the ER.
Okay. Is it possible to make homemade masks? What is the best way to do that? And who should be wearing masks at this point?
Okay. Again, the masks, gloves, these things at this time should be left for the healthcare providers. We are in a shortage. I don't know if you can see behind me, but 3 weeks ago, this room was full. It was full of gloves. It was full of masks. It was full of all the equipment that we would need. And we are now so low that the little that we have, we're locking it up for emergent situations. That's scary for us. That's scary for the healthcare providers. So please don't wear a mask. Previously, we were saying, if you're immunocompromised or if you're sick, you may be able to wear a mask, but no compromise if you're sick, if you're elderly. At this time, Michigan is on a complete lockdown, so most people should be home anyways, particularly if you're sick, to stop the spread of the virus. But Beth, you asked about who should be utilizing those materials. At this time, it's the healthcare professionals. So I do not advise you making a home mask. And in fact, I will say that masks, especially for a healthier person or someone who's not exhibiting symptoms, it almost can precipitate an illness. When you put a mask on, you're constantly adjusting the mask, you're touching your face unknowingly. So you can actually, it's probably easier to infect yourself if you're a healthy person wearing a mask anyways.
Okay. Is it safe to eat takeout? What if the person preparing the food is infected?
Well, ideally, if someone preparing the food is feeling ill, they would be home. So that I'll say that for one. And if anybody is listening and is having symptoms or feeling ill, talk to your doctor. And, if you feel like you're in a job that you can't take time off, I've been writing letters for patients all week, letting their employer know that they need to be home. But again, we need to eat. If you can cook at home, that's ideal. If you can have the grocery stores delivered to the doorstep and you're not leaving the house, that's ideal. It's not the case for everybody. Some people will get takeout. So what I would say to that is use standard precautions. Remember, this virus is spread person to person. Respiratory droplets. Yes, we know that the virus can live for a period of time on some surfaces, but just be careful is what I would say to that. So if you're getting takeout, perhaps throw away the plastic bag that it's wrapped in. And then once you eat, just be mindful not to touch your face, wash your hands immediately, and then, wipe down the counter that you were eating at. But again, it's too difficult to take these precautions with everything. We still have to live our lives as much as we can. But taking standard precautions is my recommendation.
Okay. We have a lot of questions coming in on the Facebook live stream. One of the ones we're seeing come up a lot is it safe to walk outside?
It's a great question. So healthy people, I would say, yes, walk outside, go outside, maintain the 6-foot distance, please. I cannot emphasize that enough. Unless it's someone in your home that you've already had close contact with, there will be other people out there. So maintain that distance. But today is going to be 55 degrees. Please go outside, take a walk. If you are healthy and not exhibiting symptoms. If you have symptoms, I do not recommend being outdoors at this
time. Dr. Daiza, I don't know if you can answer this, but we had a question. Why is there such a significantly higher rate of reported infection in Michigan versus states with higher population or higher population density? Does this have to do with the testing availability here, or are we just have a higher infection rate?
It's a good question, and I don't have a good answer for it, unfortunately. Here in Michigan, we're pretty limited on testing. A week ago, I reported that we were testing, or here at Henry Ford, about 100 people per day. And I thought for sure by the end of the week, we're going to hit 1,000 people per day. Well, we're at 200 per day right now. So we're not even really testing that much. And in fact, there's probably a lot more people infected than we know of. But I don't have a good answer for that. We are hit pretty hard here in Michigan. That's very true. The cases are going up and they will continue to go up, but perhaps something to do with testing, but we're really not testing that much anyway. So I don't have a good answer to that.
Okay. For folks who are trying to, ward off coronavirus or lessen their symptoms, do things like vitamin C, elderberry syrup, zinc, do those things help in that respect?
So vitamin C can, boost your immune system slightly. I would say it's not going to hurt you if you want to take vitamin C, but these are not things that we recommend regularly. If you want to, mainly it's living a healthy lifestyle is what I recommend. Overall, a healthy lifestyle. Are you eating healthy? Are you getting enough sleep? Sleep is so important. Are you getting enough water? Sunlight. I know we can't go out. I mentioned a little bit earlier, it's okay to take a walk, but what about those who are sick and they can't go outside? Sit in a well-lit room, open all the windows, try to get as much sun exposure as you can. So aside from just taking supplements, it's an overall healthy lifestyle that will help you.
Are there extra or specific risks for pregnant women?
Also a good question. So pregnant women are considered immunosuppressed. And so what does that mean? Their immune system is a little bit lower during pregnancy. And the reason is because, we don't want our own antibodies to affect the baby in any way. So naturally during pregnancy, a woman's immune system is down. So as a pregnant woman, you are more susceptible to getting a virus or any other disease than the average person. So taking a little extra precaution for a pregnant person is necessary.
Okay. If you have to cough, what is the safest way to do it? I mean, we've heard a lot of people say cough into your elbow, but then is it on the material? And, what's the best way to cover your cough in that respect?
So yes, coughing into your elbow, that is the way to do it. If you have a napkin, if you have something that you can throw away easily, that you can cough into, then that would be fine. Again, we know that this can be transmitted person to person. That's the main thing. So if you have to cough, just make sure that you're washing your hands and you wash your clothes as soon as you can, and that you're just not close to others. Again, the virus can live on surfaces, but the main transmission is person to person. So I want to emphasize that.
this is a question we got in yesterday, and it's a little bit personal, but it's, what is it like being a doctor during this pandemic? Do you worry about infecting your family?
This is a very trying time for all healthcare professionals. I'm speaking for myself as a doctor, but I see it in our nurses, the rest of our medical staff at the hospital. It is very taxing on every single healthcare worker. We take it personally. This is something we are fighting to protect all of you. So a tough time, very tough time. And I know it's tough for everyone. And do I worry about infecting my family? Of course I do. I mentioned earlier that my 87-year-old grandmother, who I normally have Sunday dinner with, I haven't seen her for her protection. But this is a good time for me to say this. Even though we are physically distant from one another, please make time to call each other, to FaceTime each other, to communicate with each other. Beth, I rarely will encourage screen time. This is the time I encourage screen time. This week in particular, I've gotten a lot of visits with patients who have been feeling anxious and depressed, that they're home, they might lose their job. I mean, it's tough. It's a tough time. Your elderly grandparents may be feeling alone because, my grandmother sees me every Sunday and I haven't been able to see her. So reaching out to your loved ones, making sure that they know that they're loved. And it's funny because my grandma, she's the only person that I'll answer a phone call from during the day. We've been swamped. And she called me yesterday and said, well, I already know you only have 2 minutes. You don't have to tell me. I know you have 2 minutes. And she said, but I want to remind you that you and all the other healthcare professionals, you're an extension of God's hand. And I'm praying for you. And I'm praying for all of you. And I just got chills saying that. But people are praying for us. People are wishing the best for us, and we will continue to work tirelessly to beat this virus.
Thank you for that. Why does it seem that children don't get coronavirus as badly as adults?
So children are not exempt. I want to make that clear. Most cases across the board, 80% of cases are mild, or they may not have any symptoms at all. And we know that kids have done very well for the most part, although we do have some cases where they are not doing well. 20% of our cases in the hospitals right now are young people. So young people are not exempt. But perhaps with the younger children, it's something to do with their immune system. And I know that is something being studied at this time. But just to be clear, they are not exempt. And most importantly, they can transmit the virus. It goes along with your question earlier about should grandparents be watching grandkids? Well, the grandkids may not have any symptoms and harbor the virus and easily transmit it. And that's what we're trying to avoid.
Okay. Everyone is talking about flattening the curve. What does that mean?
Yes. So it goes along with the community isolation, the social distancing. The reason that we're doing that is because we are trying to avoid this influx at once to the ER and the hospital system, because our hospital system is not designed and cannot handle a huge influx of ill people at the same time. So if you've seen the curve, and I'm sure you have online, you can see that it's got this huge peak and then sort of a line across, and that line across is our threshold. And anything below that is what we can handle in our hospital system, and anything above that is where it's overwhelming to us and we can't care for you as we want. I want to emphasize that other diseases are not stopping for coronavirus. We are having heart attacks. We are seeing stroke patients. The flu is out there and rampant. So these people need emergent medical treatment as well. And so if we can help stop the spread of coronavirus, it can help flatten that curve so that we are below the threshold so we can properly take care of every single one of you.
What do you think is the biggest misconception about coronavirus?
That young people are not affected by it, and they are. Young people are not exempt from this disease. I mentioned earlier about 20% of our patients in the hospital with coronavirus are young people, and particularly the young people that have other conditions like asthma, for example. It's a lung condition. This is a respiratory virus. So if you have underlying asthma, for example, you are more susceptible to developing complications, unfortunately. So young people, not exempt, although they have been doing better than the elderly, not exempt, and they are carriers. And so, again, the reason why we're practicing social distancing.
Is it safe to give blood right now?
I would say, if possible, not to leave the house. I know that, the TV has mentioned that we are low on our blood supply, but if it's possible, even if you're a healthy person, especially here in Michigan, we are on a complete lockdown. Please, under only extreme circumstances, leave the house. If it's for work, if it's for food. Otherwise, I recommend just staying home at this time.
Okay. When do you think we'll reach like peak numbers in Michigan, or when do you think this will be over?
I wish I had an answer to that question. But I will say that as long as we are following the CDC guidelines and social distancing and only going out when we have to and taking precautions if we're sick, the more we comply with the CDC guidelines, the sooner this will be over for all of us. So although I wish I could say next week or the week after, I can't say that because I don't have an answer, but hopefully sooner rather than later.
Okay. Well, thank you so much for joining us today, Doctor. I think we were able to answer a lot of questions, but if people have additional ones, please keep sending them in, and we will try to get answers to those as soon as possible.
Thanks for having me. It was my pleasure.
Yeah, no problem. Stay safe.
Thank you. You too.
Bye.